of the mind?
First of all, I'll put it out there, dialysis is expensive. So I'm going to break it down. You have dialysis session, you have the tests, and you have medication that you have to keep using when you have these problems. Do you understand? Now, a dialysis session, at least in my center that I work, give or take, is about 45,000 naira per session. Now, note that a patient or an end-stage disease patient is doing dialysis 2 times to 3 times weekly. Do you understand? Optimal is 3 times weekly. So you need about 12 hours of dialysis per week to have optimal dialysis in a way that you can function well.
Yeah.
You understand? So let's just say 3 times per week. So 45,000 3 times per week. And you're doing that in a month. Do you understand? Then you are buying medications. So sometimes when your kidneys poor, some of the complications you have is you have hypertension, high blood pressure. So you're on continuous high blood pressure drugs. Do you understand? Okay. So government hospital 35,000. There are some government hospitals 40,000. So let's just say between 40 and then the private hospitals like maybe Dutchess, they are doing like 50, 60,000 there, 70,000 in some other hospitals. Do you understand? But let's just give you a range, you know. So you are buying medications and all that. And aside from that, you are doing tests. So say you come today, all of a sudden you're having sepsis or infection, because people that have kidney problems are usually susceptible to infection due to their immune system is reduced or their immune response to different kinds of infections are reduced. They usually come down with things like sepsis, UTIs, frequent UTIs, frequent respiratory tract infections, so medication and all those things. So me and my consultant did a calculation, give or take, about how much a dialysis patient is supposed to be spending per month, and it goes upwards to about 700,000 naira, 500 700,000 naira per month. It's crazy, and you're doing that per month. Now, how much is an average person in Nigeria making per month? Now, let's go to transplant. So now, let's say you have done dialysis for a while and you want to go and do the renal transplant. Now, renal transplants in Nigeria is now around 30 million to 35 billion, and that is just transplant. I'm just talking about the transplant. I'm not talking about the pre-transplant tests. I'm not talking about the post-transplant workups. I'm not talking. And then when you do transplants, after you do transplants, you're going to be on medications for life, and you have to keep those medications. You cannot stop, otherwise you're going to have kidney rejections. Do you understand? So per month, at least for the first 3 months, you are doing 500,000 naira on transplant drugs per month. That's after paying 35 million naira for the transplants, paying some more. You see some patients paying up to like 7 million, 10 million for pre-transplant workup. So you're doing your HLE typing, you're doing your scans, you're doing all those things. And that does not now mean that the donor that you bring first might be the donor that will be able to give you the kidney. Because if the HLE typing is not working well or it doesn't match, you go and find another person again. You house